Welcome. Today we have a case of a 42-year-old male who presented with features of acute abdominal and fever for the last 3 days. The patient raised WBC count, and at this point, I would like you to pause the video and scroll through the scan to see if you can make the diagnosis on your own. So, this is an axial cut CCT scan of the patient, and here we can see that the liver, gallbladder, spleen, and both the kidneys are more or less unremarkable. As we move further down, we can see wall thickening and enhancement along with facial prominence noted at the level of hepatic flexure. These changes become more and more prominent as we descend caudally up to the level of cecum, and here we can see the formation of the ileocecum junction and the similar changes of wall thickening and enhancement seen at the level of ileum, terminal ileum as well. Going further down, we can see that the appendix is showing good enhancement and wall thickening at the level of its origin, and the whole of the appendix is quite dilated. Along with that, we can appreciate haziness of the mystery. It can be seen more clearly by adjusting a little bit of the window, and we can see the haziness as compared to the other areas of the mystery, suggestive of inflammatory or infective changes. Along with that, we can see lymphadenopathy here and raised vascularity. Again, all of these features are pointing towards an infective or inflammatory etiology. Again, we can appreciate the prominence of the facial planes as previously described. So, one more thing we would like to add here is while some people, especially the young students, they prefer to look in the coronal or the sagittal sections as it helps them to pick up the diagnosis very fast. But remember, in cases like this, one might confuse the appendix as a part of the cecum itself. Now, if we put a marker here and we try to see the origin of the appendix, we can see that this is the appendix and it is going just behind the cecum. So at times it becomes really difficult to pick these things up on the coronal scan. So one should be aware of using all the three sections before making a final diagnosis. Thank you so much. Have a nice day ahead.